Patient safety is one of the top priorities in healthcare today, and ensuring the highest quality of care begins with properly trained and well-prepared clinicians, trained not only in high-volume routine medical presentations, but educated in the highest risk and often lowest volume untoward events. That's why targeted continuing medical education has become a foundational component of a successful patient safety program and the most meaningful pathway to lifelong learning. As more education opportunities migrate to an online environment, technology and innovation are revolutionizing the learning experience. The concept of using validated assessments to target evidence-based learning and to build an individual curriculum is the future of continuing medical education, and nowhere is it more critical than in the field of obstetrics. Gnosis for OB is an assessment-driven education and analytics platform that is transforming how OB providers and nurses learn through the power of proficiency data. Gnosis begins with an assessment. Clinicians complete a series of targeted questions that measure both knowledge and judgment, a unique measurement of situational awareness and critical thinking, in concordance with the results of industry-leading subject matter experts. Once the assessment is completed and scored, an algorithm instantly builds a prioritized curriculum called a personalized learning path. The clinician is then presented in 2 to 8 minute segments with the education content where they truly need improvement. As a result, clinicians can benchmark their proficiency levels against the nation's largest database of its kind, with data aggregated from over 70,000 assessments, and gain a better understanding of which specific practice areas require their focus. By providing clinicians with only the content they need to learn, studies prove that they are significantly more engaged with the curriculum. The time spent in the assigned coursework for nurses on average increased 3 times and providers over 6 times. For the first time, clinical teams can measure their proficiency levels, and after completing the personalized learning path, they can track their improvement and growth. Studies prove that clinicians who perform in the lower quadrant improve on average 37 percentile points after using Gnosis. And ultimately in practice, this means improved patient safety. For example, reducing risk, where one group has reported a 55% reduction in risk exposure, and also improving clinical outcomes, as documented by one hospital who experienced a 38% reduction in massive transfusion protocols. Assessment-based, personalized learning is making a difference in obstetrical practice at over 500 hospitals across the U.S. Dr. David Giammittorio, CEO of the Physician and Midwife Collaborative Practice in Alexandria, Virginia, explained the impact that this new learning model has had on his practice and on his team.
I graduated from medical school when I was 25 years old. I started practicing medicine when I was 29. At 29, I knew everything. 37 years later, I'm not so sure I know anything. So I have a vivid memory of attending my medical school graduation. The dean of the school charged us all with being lifetime learners. I really didn't understand quite then, but it's been 3 lifetimes now, and I understand completely the dean's direction. I learned about Gnosis through the OBGYN Risk Alliance system. They suggested that Gnosis would be both good for my continuing education and potentially to reduce malpractice exposure. If we reduce malpractice exposure, we reduce costs. This is always a good thing. In our practice, our clinicians come to us with different qualifications and with different life and work experiences. And to get everybody on the same plane, the Gnosis platform is excellent. If we begin to speak in the same language, then we can address a particular problem in a certain way. This reduces unexplained variation and inevitably raises quality. I found particularly interesting the FAM educational system. I had received much of my education in the earliest days of fetal monitoring and found that I wasn't up to date in how to discuss findings on the fetal monitor. and that the nursing staff of the hospital and the younger physicians use different words to describe the same thing. And as we all come together to use the same words, we have more effective communication. We can communicate with each other more efficiently, and we can even communicate with the patient in a more positive way. And this is absolutely invaluable. One thing I find very interesting is that Gnosis has something for every type of learner. Some people learn better by reading, some visually, some orally. And Gnosis is built to keep the learner engaged and interested. In the delivery suite, I can sit my laptop in the corner and pick it up, study a few minutes, go down the hall, do some clinical work, come back down, review where I've been. And I think one of the best things that Gnosis does, it assesses me first. If I approach a subject and take the assessment and find that I am up to date, then I don't have to spend any more time in that area. We focus on things that I could use some brushing up on. This is a terrific thing. Better, faster, cheaper. Honestly, I mean, you know, for me to get on an airplane, to get where I'm going, to listen to the speeches, to assimilate the facts, and come home is a lot of work. With Gnosis, I can take a half hour or 30 minutes at any time. I can save where I am, I can go back to it, and learn. After all, I still remember the dean's words: become a lifetime learner.